Hey everyone, welcome back. Today we're diving into a topic that's so important but often overlooked: the connection between oral health and disabilities.
It's something that deserves way more attention than it usually gets.
Right. And, whether you're someone who lives with a disability or you're a caregiver, family member, or friend, understanding this connection can make a world of difference.
Absolutely.
So we've been digging into this fascinating article that really breaks down how different disabilities can impact oral health. And trust me, it's eye-opening stuff. We're talking about everything from genetic conditions to physical limitations, all these factors that can create unique challenges when it comes to taking care of your teeth and gums.
Right. It's not a one-size-fits-all approach, that's for sure.
Exactly. And, we're not just here to lay out the challenges. We're going to dig into those practical tips and insights that can empower you to take charge of your oral health or support someone you love in doing the same.
Because knowledge is power.
Right. 100%.
Yeah.
So are you ready to unlock some of that power together?
Let's do it. I'm ready when you are.
Okay, let's dive in. So the article starts by hitting us with a pretty big reality check. Genetic conditions can have a huge impact, and not just on oral health, but on overall health too.
Yeah, it's all connected.
It really is, and we're talking about a whole spectrum of challenges here, everything from physical limitations that make it tough to brush and floss to difficulties with eating, breathing, even saliva control.
When you think about those basic things, eating, breathing, even just producing enough saliva, you realize how much we take them for granted.
It's true, and when those things are compromised, it can have a ripple effect on your oral health.
Exactly.
Which is why the article highlights that people with disabilities often face a higher prevalence of tooth decay, gum disease, and other oral health issues. It's something to be mindful of.
It is, but here's the thing, and I think this is really important to emphasize. Having a disability doesn't automatically equal bad oral health.
Right. It's not a foregone conclusion.
Not at all. With the right care and support, people with disabilities can absolutely thrive.
I love that positive spin.
It's about understanding those unique needs and tailoring the care accordingly. And that's where the concept of special needs dentists comes in. They're like the superheroes of the dental world.
Okay, superhero dentists. I like where this is going. Tell me more about these specialized dentists. What makes them so special?
So basically, they have specialized training that equips them to work with individuals who have physical, cognitive, or developmental disabilities.
So they know how to adapt their approach, how to communicate effectively, how to make the whole dental experience less stressful and more comfortable.
You got it. They're all about creating a safe and supportive environment for their patients.
That's so important. It's like the difference between seeing a general practitioner versus a specialist. You want someone who truly understands the specific needs of their patients.
Exactly. And this actually ties directly into something else. The article highlights the Americans with Disabilities Act, or the ADA for short. Now, when you hear ADA, you might be thinking about wheelchair ramps and accessible bathrooms, right?
Yeah, those are usually the first things that come to mind.
Right, but it goes way beyond that, especially when we're talking about healthcare.
So break it down for me. How does the ADA impact something like, say, going to the dentist?
Well, for starters, it ensures that dental practices are physically accessible, so think wider doorways, ramps, that kind of thing. But here's where it gets really interesting. The ADA also requires dentists to communicate effectively with patients who have disabilities.
That's huge. Communication is key in any healthcare setting, but especially when you're dealing with something as sensitive as oral health.
Absolutely. So we're not just talking about physical access here. We're talking about ensuring that once you're in that dental chair, you're able to fully understand and engage in your own care.
Which could look like providing materials in Braille, having interpreters on hand, even just taking that extra time to explain things in a way that makes sense for the individual.
Exactly. It's about removing those barriers and making quality dental care truly accessible for everyone, regardless of their abilities. And speaking of understanding the nuances of different disabilities,
The article goes on to explore some specific conditions to give us a closer look at how these challenges play out in real life. Right?
exactly.
And it's not meant to be an exhaustive list or anything, more like a starting point for wrapping our heads around the complexities involved.
Exactly, because every individual is different, every disability is different, so there's no one-size-fits-all approach.
Right. So let's jump into the first condition on our list, which is autism.
Yeah.
Now, the article really emphasizes how those difficulties with communication and sensory sensitivities that are often associated with autism can make something like a routine dental visit really challenging.
It's true. Imagine all those sights, sounds, and smells that might not bother most people, But for someone with sensory sensitivities, it can be totally overwhelming, even painful.
Yeah, it's like their senses are on high alert, which can make it hard to relax and feel comfortable, especially in a setting like a dentist's office.
Right. And then you factor in the communication aspect, which can be tricky, and it's easy to see why dental visits can be so difficult for some people on the spectrum.
Exactly. And that's where finding a dentist who's experienced in working with autistic patients is absolutely crucial.
Oh, 100%. You want someone who understands those sensitivities, who knows how to communicate effectively, and who can create a calming and predictable environment. They might use things like visual aids, for example, or desensitization techniques to help make the experience less overwhelming.
And sometimes, even with those strategies, a little extra help is needed, right?
Exactly. And that's where sedation dentistry comes in.
Ooh, sedation dentistry. That sounds intriguing. Can you tell us a bit more about that? Imagine, if you will, being able to sail through a dental appointment without feeling a thing. Tell me more.
It's like a superpower. Basically, sedation dentistry involves using medication to help a patient relax, or in some cases, even become completely unconscious during a procedure.
So it could be a total game changer for people who experience a lot of anxiety or sensory overload at the dentist, right?
You got it. Now, moving on to the next condition the article covers, we have cerebral palsy, which presents a whole different set of challenges when it comes to oral health.
Yeah, because cerebral palsy primarily affects muscle movement and coordination, right?
Yeah.
So I imagine something as simple as brushing and flossing could be really difficult.
You're exactly right. The article really digs into how those physical limitations, particularly those affecting motor control, can make it tough to maintain good oral hygiene, which puts individuals with cerebral palsy at a higher risk for cavities and gum disease.
And it's not just about the physical act of brushing and flossing either, right? There are other factors at play here.
Exactly. The article mentions that things like mouth breathing and tongue thrusting, which are more common in individuals with cerebral palsy, can also impact oral health.
It's like putting together a puzzle, isn't it? You have to look at all the pieces to get the full picture.
Precisely. And then, of course, you factor in the potential need for orthodontic treatment, which can be more complex for people with cerebral palsy. And you can see how important it is to have a healthcare team that really understands the intricacies of this condition.
It's about having that specialized knowledge and being able to create a care plan that addresses the individual's unique needs.
Absolutely.
Now, I know we don't have time to do a deep dive on every single condition the article covers, but I think we should at least touch upon the remaining ones.
I agree. Even a brief overview can be helpful in understanding the scope of the issue.
So much to unpack,
Right.
and we've really only scratched the surface.
It makes you realize just how much we need to be aware of, even with something as seemingly straightforward as oral health. There's always more to learn.
Totally. But even in this short amount of time, I feel like we've already uncovered some really important common threads.
Oh, absolutely. For one thing, having a healthcare team, including a dentist who's experienced in working with people with disabilities, is crucial.
Huge. And being sensitive to their communication styles, it's everything.
Makes all the difference. And let's not forget the caregivers out there, the unsung heroes. Their role in supporting their loved ones' oral health is so important.
Absolutely. They're the ones on the front lines, day in and day out, making sure those needs are met.
Exactly. And sometimes, even with the best care, there can be additional challenges. Which brings us to the next condition highlighted in the article, dementia.
Ah, yes, dementia. As if navigating the world with dementia wasn't already challenging enough, the article talks about how cognitive decline can impact someone's ability to maintain good oral hygiene.
It's true, those daily tasks can become incredibly difficult. It becomes less about someone being able to brush and floss on their own and more about the caregiver needing to step in and provide that support.
Right, making sure they're brushing regularly, helping them floss, maybe even adapting the way they brush to make it easier. It's a team effort for sure.
Absolutely. And it requires a lot of patience and understanding from the caregiver. It's not always easy, but it's so important.
It really highlights how crucial those personal connections and that compassionate care are, especially for individuals with dementia.
Okay, shifting gears a bit here. The next condition we're going to touch on is Down syndrome. And this might sound familiar. The article highlights an increased risk of periodontal disease, which we've talked about before.
Yeah, we've already touched on how important specialized care is for individuals with communication challenges, which I imagine might be relevant for many people with Down syndrome.
Exactly. You want a dentist who's going to take that extra time to build trust, to communicate in a way that makes sense for the individual, and to create a positive and supportive experience.
It's not just about treating the condition. It's about connecting with the person.
100%. Now, ready for a two-for-one deal? We've got cystic fibrosis and muscular dystrophy to cover as well.
Bring it on. I have to admit, though, I never really made the connection between those conditions and oral health before reading this article.
See, that's why we do these deep dives, to uncover those hidden connections. So, with cystic fibrosis, remember how we talked about the impact of thicker mucus?
Yeah, how even something like mucus consistency can have these ripple effects on oral health.
Well, in individuals with cystic fibrosis, that thicker mucus can make them more susceptible to certain oral health issues.
Like oral thrush, right? I remember reading about that.
Exactly. It can create a breeding ground for bacteria in the mouth, which can lead to all sorts of problems.
It really drives home that point about interconnectedness, doesn't it? Oral health is about so much more than just brushing and flossing.
It's a reflection of our overall health and well-being.
Totally. Okay, so what about muscular dystrophy? What are some of the key things to be aware of there?
So with muscular dystrophy, the big thing is the weakening of those facial muscles. And you might not think about it, but those muscles play a huge role in oral health.
Right. Chewing, swallowing, even just closing your mouth completely.
Exactly. And when those muscles are weakened, it can impact all of those things.
And like you were saying earlier, not being able to close your mouth completely can lead to dry mouth, which is a recipe for disaster when it comes to oral health.
Saliva is so important. It helps wash away food particles and neutralize those acids that can erode tooth enamel.
Okay, so we've covered a lot of ground here, but as we wrap up our exploration of this article, something's been bugging me. We talked about how kids with Down syndrome might actually have fewer cavities than other kids, and that just seems counterintuitive. What's the deal with that?
Right. You'd think it would be the opposite, wouldn't you? But yeah, it's a really interesting point the article brought up. It's not quite fully understood, but there are some theories floating around.
Well, let's hear them. What are the experts thinking?
So one thought is that it might have to do with the size of their teeth.
Okay, smaller teeth, smaller surface area for cavities. I can see that.
Exactly. And there might be some dietary factors at play, too.
Like what?
Well, sometimes children with Down syndrome might be on stricter diets for various health reasons.
Makes sense.
And those dietary restrictions could actually end up benefiting their oral health in the long run.
Interesting. So it's not as simple as saying, oh, this condition means you'll have more cavities, or that condition means you'll have fewer.
Right. It's way more nuanced than that, as we've seen.
It's about the individual and all the different factors that contribute to their overall health, which includes their oral health.
100%. It's about personalized care, understanding the specific needs of each person, and working with them to create a plan that works.
Well said. This deep dive has been incredibly eye-opening, and I feel like we've barely scratched the surface.
Oh, there's always more to learn. But hopefully, this gives our listeners a good starting point for thinking about oral health in a new way.
Absolutely. And remember, knowledge is power, so keep those questions coming. We'll be sure to link to some helpful resources in the show notes if you want to explore this topic further.
Exactly. Don't be afraid to advocate for yourself or your loved ones and to seek out those specialized providers who can provide the best possible care.
Couldn't have said it better myself. Until next time, everyone.
To healthier smiles.